Hi, my name's Courtney. This is my case study on renal artery stenosis for my vascular class. This patient was a 24-year-old female with no significant past medical history, presents to her primary care physician with 3 months of severe pulsating headaches. Blood pressure measurement in the office was 174 over 109. The patient was told to keep track of her blood pressure daily. For the next 2 weeks, blood pressure remained elevated, ranging from 160 to 200 over 100 to 120. She was started on anti-hypertensive medications, which were slowly escalated over the next 3 months, but provided only minimal benefit. The patient subsequently underwent a renal Doppler ultrasound, showing indirect evidence of renal artery stenosis. The patient was referred to our interventional radiology clinic to discuss possible diagnostic and treatment options. A computed tomography angiography study was ordered, which showed a beaded appearance of alternating stenosis and dilation of the right renal artery. Patient was most likely has fibromuscular dysplasia. So renal artery stenosis is a major cause of secondary hypertension. It affects 1 to 4 million Americans and is the cause of hypertension in 0.5 to 10% of all patients, and approximately 30% of patients with accelerated hypertension. Renal artery stenosis has high prevalence in patients with atherosclerosis, in particularly 15 to 30% of patients with coronary artery disease, and 22 to 59 in peripheral artery disease. Fibromuscular dysplasia affects 5 to 10% of patients with renal vascular disease. Renal artery stenosis is defined as a fixed narrowing of renal arteries. May lead to refractory hypertension, ischemic neuropathy, and or pulmonary edema. Refractory hypertension, poorly controlled hypertension, despite being treated with optimal doses of 3 anti-hypertensive drugs of different classes. Ischemic neuropathy, declining renal function, and atrophy secondary to poor renal perfusion. Here is some physiology on renal artery stenosis. Stenosis causes decreased renal perfusion, which causes renin release. Renin then activates angiotensin II production. Angiotensin II production causes efferent atrial constriction, which increases glomerular hydrostatic pressure in order to maintain glomerular filtration rate. Elevated angiotensin II effects included systemic hypertension, aldosterone elevated leading to sodium water retention and diastolic dysfunction. Fibromuscular dysplasia is a rare vascular disorder that causes abnormal cell growth in arterial walls. The classic string of beads signs has been reported in many cases, whereas the appearance of tubular stenosis and distal tapering of renal arteries with multiple renal infarctions. The cause of FMD is unknown, although 10% of these cases are thought to be genetic. Smoking is closely associated with FMD, but directly casualties have not been proven. Here is some diagnostic workup on this 24-year-old female. These images show reduced flow of the left renal artery compared to the right artery, which is normal. The left side also shows decreased waveforms, decreased peak systolic velocity, and increased retentive index. This top image is showing you the right kidney, and the bottom image is showing you the left kidney. Here's another ultrasound image showing peak systolic velocity exceeding 180 centimeters per second, and the retentive index is greater than 0.7, suggesting stenosis of the left renal artery. Some treatment. Fibromuscular dysplasia with hypertension patients are usually prescribed ACE inhibitors. Refractory hypertension is balloon angioplasty. Hypertension and atherosclerosis and renal artery stenosis, aspirin, cholesterol-lowering drugs, smoking cessation, and essential to limit atherosclerosis. Here are some things that need to be discussed about renal artery stenosis. The management goals in renal artery stenosis are to control hypertension, preserve renal function, and prevent recurrent/pulmonary edema. It is important to note that FMD is significantly caused by renovascular hypertension, especially in young women. An expert consensus statement on management of FMD states that revascularization should be attempted only in those with evidence of systematic disease like renovascular hypertension or renal atrophy. Here's a stent that was placed for that 24-year-old female. This is an angiogram showing initial stent placement. Here you can see where the stent has been placed. This is also another image of a CT showing where the stent has been placed. And here is my references. Thank you so much for listening.